Our guest today is Dr. Catalina Lopez Correa. She is the Chief Scientific Officer of Genome Canada. Not only she's a medical doctor and a genomic scientist, but she was also diagnosed with breast cancer in April 2023.
Well, first, thanks for the invitation. Today is really an honor to be here. And thank you, Nilu, for inviting me and for giving this opportunity and this voice to cancer patients.
Oh, thank you so much for accepting the invitation. You've been a medical doctor, a genomic scientist. On the day you were diagnosed, how did you feel? Can you kind of walk us through about that day? And I'm sure it was a emotional and mental challenge.
Yeah, absolutely. So I think I can start from the moment where I detected a lump in my breast. And it was really, at the beginning, you think, oh, this is nothing. This is going to be, just a little thing. But you still in the back of your mind. And when you say, train as a medical doctor, I sometimes say it's good to know, but it's not that good to know that much. So that's one of those cases when it's not good to know that much, for me at least, because I started to be super anxious, like, oh, what is this? At the same time, trying to think, oh, this may be nothing. I detected the lump end of February, and I ended up traveling for work and not thinking about that. Finally, I decided to get an appointment with my family doctor, and the family doctor says most likely nothing, but we're still going to check it and do a mammography. So I went for the mammography. That's where I think I'll say from the entire journey, there are many, many challenges, but that was a very challenging time because it's where you are waiting, 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 and waiting to get a diagnosis, waiting to get a test. So the doctor sent me a mammography, and when I start calling to try and get the appointment for the mammography, they told me, oh, the earliest we can get you is in June, July. I was panicking. My anxiety level there was super high. The day you get your diagnosis, you've been building up all this anxiety because you're like, okay, mammography is not normal, get the ultrasound. Ultrasound is not normal, get the biopsy. You're already like, your red flags are all kind of just up and there. And that day, April 11, 2023, when I got my diagnosis, is like, I think every cancer patient says, is a day that completely changed your life. Yeah. Is a big emotional moment. Even though, funny enough, I was that day traveling for a business trip, and I call my boss and say, well, I've been just diagnosed and I don't know what to do. I called him from the airport actually because I was like, I don't know what to do. I don't know
Did you get like a report that came like that?
Nothing. Not yet. No, at the beginning, I didn't even have documents yet or anything. It was just the doctor say, it's cancer.
Oh, so you had like a phone call?
She wanted to see me in person. So I went to see my family doctor. I went in that morning. So the family doctor, she said, it's cancer. So that word is already like, just cutting your life up, breaking your life in two pieces. So yeah, it's cancer. And we're going to get all the information. You're going to get your biomarkers. You're going to get all the information about the tumor. But for now, you have to think about what you're going to do. This is going to be a long journey. You have to go through treatment, potentially surgery, and we don't know anything yet. So you basically, for me, it's like you jump into a swimming pool without knowing how to swim because you don't know how to navigate that. It's dark, it's cold, it's very unpleasant. So yeah, I was at the airport after the doctor. I was trying to think like I should continue my life. My life is not stopping here. I should continue my life. And I don't even know what it is, how advanced, nothing. So finally, I decided to, talk to my partner, talk to my family, my mom, and cry and got, all the emotions. But finally decided to go to that business trip to try and kind of clear my head and think about other things, as opposed to sit at home and start wondering and being all stressed out. And from there, starts a journey of more testing, starting to get your results. As a friend of mine in Colombia called them, they give you the first name, breast cancer, and then you start to get your last name. Like, what are your biomarkers? Is it, in my case, Herceptin negative, estrogen positive, progesterone positive? You start to get all that and learn about all those things.
And is that part of like standard care to get those biomarkers?
Now it is. It wasn't maybe 10 years ago. It was still like, I remember me as a scientist making presentations and talking about breast cancer, talking about Angelina Jolie's story and hereditary cancer. We can talk about that later. 10, 15 years ago, it was not standard of care. Now I'm surprised. It's a standard of care here in Canada. It's a standard of care, I think, around the world. At least all my friends in Colombia are getting these three biomarkers: your estrogen, your progesterone, and your HER2.
And that affects treatment.
And that really defines treatment. And that's why, I also used to say in my presentations, and now I'm kind of living this in my own skin, I used to say we should not name, cancer should not be classified according to the organ where it's located. It should be classified according to the biomarkers that the cancer has, because that's what really tells what the treatment is. Two women with breast cancer, same age, might have completely different treatments depending on the biomarkers.
Right.
So in my case, those three biomarkers indicated, well, I need surgery, but it wasn't still 100% sure I needed chemotherapy. And that's when genomics started to play,
a big role
Yeah.
into your treatment. Okay, so, by the point that you found a lump, you can say on average it might take 3 to even 6 months until you actually have a full diagnosis. And, that wait time is one of the most challenging parts of this journey. And you've heard my mom's story. Exactly, saying like the month to get the diagnosis, you're thinking of the worst case scenario, and sometimes your gut feeling. Did you have that gut feeling too that something might go wrong? What did you personally think, that is this ever gonna happen? Because some people, when they get diagnosed, are like, oh, I didn't think this could happen to me. Did you ever have that feeling?
Yeah, well, I think I mentioned to you when we were chatting before that my dad died of brain tumor. So that also, that was 70 years ago. And for me, that completely, it was like for you, completely changed my life in a way. And from that moment, seeing your dad dying and, first being diagnosed with a brain tumor and dying from it, it really also made me think like, we are all susceptible. We could all eventually at one point get something. I wasn't thinking, of course we think like I was healthy. I was, working, exercising, doing, I had no symptoms, no nothing. I was feeling maybe the last year, and I was always thinking, oh, is this because of the pandemic? I got COVID at one point. So is it that I'm feeling tired and more exhausted?
To kind of try to come up with reasons.
Exactly. You're trying to justify yourself.
Exactly. Like,
Like-
what happened? Why is this happening?
Exactly.
And the moment when you met with the doctor and said you had cancer, in that moment, were you kind of like, kind of blank, like, oh wait, what happened? And then kind of didn't really process it. How long did it take for you to process of what the doctor told you about your diagnosis?
Well, it took me a while, and at that first appointment with my family doctor, it was just a simple appointment. It was just basically say you have cancer, and I have to digest that new the news. I went, so that first, I would say 2 weeks or 3 weeks until I get the appointment with the surgeon. I was trying not to think much about it. And I was ignoring, basically, I went for work. I tried to keep up, with everything, organizing all the trips. And I was like, oh, I'm going to try and continue my life as normal as I can, even with treatment. Right. The one that was really challenging was the first appointment with the surgeon, the oncology surgeon. That was my first contact with, a person working in oncology. Right. I went with Maria, my partner, and I'm so glad I did. We did
go together.
Yeah, because you are there, and even though she was telling me like you're a medical doctor, you understand much more than me, but for some pieces, like it's so much information you get, and so you're so stressed. I was so
Sometimes you don't hear.
you don't hear. You get to a point, I don't know if you experienced that with your mom, but sometimes you get to a point where it's like it's an emotional shock.
It's an emotional shock. And was your partner the only person that you shared in the first like 3 weeks after the diagnosis, or did you?
No, I have been very open with this. So yeah, I share with my partner and my family, my mom, and my boss, and even my colleagues, direct colleagues at the management team at Genome Canada. So we went in this business meeting, and it was all my team, the team, the management team. So I share with them, with my two other colleagues, the two other vice presidents of the company. I chose the road of being super open.
And that's also why we're here, which I'm super grateful for. Did being open about it and sharing with your colleagues, and you say your mom, and did that help? Like, because some people could be diagnosed right now and they're trying to look into a video that, okay, is this gonna help, with my coping mechanism and my journey, or is this gonna, put more thoughts into my head? So how did sharing help?
Yeah, for me, um, it really helped. It really helped because it really allowed me to, think about my journey as something also that could help others in their journey. That was my thinking, and I have received so many messages from even women that have been diagnosed after me, and young women, very young, like some of them are younger than, between around 40 years old. I'm 56, so much younger than me. That they felt a lump, and because of seeing my journey, seeing my postings in social media, and seeing all the messages and postings I've been putting out there in social media, they thought about going to the doctor, and they were diagnosed with breast cancer.
Wow, that's powerful.
Yeah, so for me, that's I think the really paying off my effort sometimes, because sometimes, even though I'm in general open and I don't mind sharing this, sometimes it's also heavy on you when you start to get all these messages. Sometimes you're like, because it's a lonely journey, even if people are trying to help, are sending the most beautiful messages, you are there with yourself. It's a very lonely path. So sometimes these messages felt great. Sometimes I was like, I cannot even, oh my God, I cannot even look at social media, my postings. Sometimes I put the posting and I didn't look for a day or two, because I don't want to know if good or bad. It's too much for me now. The effort of putting it out there is already like a big step. Like, I don't want to know. Yeah.
That's what I noticed too. There's always a good and there's also bad. But the good sometimes is so good that it gives you the strength to keep going. Okay, and so now, moving on to the genomic testing that you talked about, anyone looking that doesn't have any idea about genomic testing, whether it's on a tumor or blood, and let's say the team of the oncologist hasn't really talked about it yet, how would you like to introduce this technology and cutting edge treatment?
Yeah, so well, for me, it has been just an incredible and very positive surprise to see that genomics is so embedded in the clinic right now. I wouldn't know now if the genomic testing is directly offered to patients. In my case, I started asking for all the tests from the first appointment, even with the oncologist. Oh, can I get my tumor test? Can I get my blood test? There is a lot that is available now, and it's important for people. As I say, as a patient, you don't need to be a genomicist. You don't need to know all the details, but at least ask the oncologist if they can test your tumor for the genes that might help guide the treatment, and if they can test your blood to see if you have an hereditary form, and if other people in your family, if you have kids or daughters in case of breast cancer, or if other people in your family might be susceptible to have cancer. I think those are the two basic ones that are being
And they're two different tests.
two very different tests. One is done in the tumor, one is done in your blood. For the one done in your tumor, in my case, it was critical because, as I say, I had the three: the estrogen, the progesterone, and the HER2 biomarkers that say how aggressive my tumor is, but didn't immediately indicated if I needed or not having, if I should have or not chemotherapy. Right. But then once I got the surgery, my lump was removed. They moved also some lymphatic nodes. So having the lymphatic nodes and having the genomic analysis in the tumor gave the oncologist really the answer that I needed chemotherapy. So for me, it was
like a personalized.
Yes, a super personalized journey. And challenging too, because when I got the results of that test in the tumor, I read before, as a scientist, I'm always trying to look for the information.
Was it helpful to know more than?
Yeah, it was helpful because I could understand a lot. My partner, again, she was always telling me like, I'm glad you understand this because I don't understand half of what you're asking the doctor. But she picked up in many other things that I maybe didn't pick up. Things about the treatment. I was very interested always in the science and the genomics and all this. So I read that when you got a score that is lower than 25, you don't need chemotherapy. When you get a score that is higher than 25, you need chemotherapy. My score was 26. So I was really borderline. But at the same time, having the lymph node removed that indicates your tumor is aggressive because it's already spreading outside of the breast, plus the score that was 26, higher than 25, that in a way I feel that, chemotherapy is super hard. And I don't want this for anybody if you don't need it. But if you need it, and I feel in my case was well justified and needed, so it makes me feel from a scientific point of view and even from a patient point of view, reassured that I'm not doing it because of the sake of doing it, but because I need it.
Right. That's very important because sometimes patients that don't want to do chemotherapy, they need some sort of a justification or clarification why do I have to go through this. What were the emotional and just physical challenges of going through chemotherapy?
That's one of these things that you need to live it or have somebody very close to you experiencing that to truly understand. I would say, as a medical doctor, person that, I've heard a lot of people having cancer, going through chemotherapy. I never imagined that this could be it's really hard. For me, it was really hard. GI effects, your effects on, losing your hair. For me, that, I never had long hair, beautiful as you have. I always had short hair, but I love my hair. And it was an important part of my personality and who I am. I will say it's a symbol. It's a symbol as much as, the hair is not painful but when you start, that moment when you start losing your hair, it's like, okay, these medications are, doing the work. Exactly, doing the work they have to do. There's lots of side effects that remain. I'm still, trying to get my hair to grow. It's been since October 6th, I finished chemotherapy. We're ending November. Well, it's going to be 2 months, and I still have nothing in my eyes.
You have beautiful eyes.
Yeah, thank you. And it's starting to come out a little bit. But it's challenging. It's challenging. Chemotherapy is, the whole treatment is challenging. But at the same time, I'm really thankful because having access to all these treatments in a timely manner, having the surgery was the most amazing experience for me because first I had an incredible surgeon that she is the most professional person. I will recommend her 200%. And she did really the least invasive. When I got my diagnosis, I was in my mind, I was like, I want a double mastectomy. I want Angelina Jolie approach. I want double mastectomy. I don't want to have this in my life anymore. I want to cut with this. I want to finish with this. I want to just, and I went with to her and I told my partner, are you okay with that? You know, I'm gonna have a double mastectomy. Is this okay? Is it, as a family, are we okay? Yeah, she's like, if you want, if this is what you want, I'm okay with, you know, I will support you. So I went with that state of mind to see the surgeon, and I say, yeah, I want a double mastectomy, and she was like, okay. Well, like she didn't say immediately no, but she started to say, you know, let me tell you, and she was like, with scientific facts, there is more risk of infection with a double mastectomy. Your recovery will be much harder and difficult from a physical, you know, point of view. And the recurrence rate is not lower than when you have a lumpectomy. So she gave me all this scientific and medical information in the right way. So at the end of the day, exactly. So at the end of the day, I just decided, and she said, I think you will be much better off with a lumpectomy. And that's what we did.
So, will every Canadian have kind of the same experience, or is it different whether you're in different province, like let's say in BC or Ontario or Saskatchewan? How's the access in different provinces and across the country?
Yeah, it's different. It's different. And that's one of the challenges we have in Canada with genomics and with healthcare in general, is that healthcare, of course, is managed at a provincial level as opposed to a national level. There are some, of course, Health Canada will provide some approvals for some medications in Canada, but then the reimbursement of those medications or those tests or the genomic analysis, the decisions for reimbursement are done at the provincial level. So that made, for some of the medications I had to take, there were some that were not approved here for reimbursement, and they were approved in Ontario or Quebec. And for the genetic and genomic testing, also, not every patient systematically have access to those. So I think it's important for patients, it's important for healthcare providers in general to be aware of the power of genomics and how genomics is really helping refine the treatment and refine the diagnosis and guide the treatment in a very powerful way. Like again, in my case, deciding chemotherapy based on my genomic profile is big. It's really, really showing.
Your treatment changed basically.
The whole protocol of my treatment changed because of the genetic test on my tumor. So I think it's very important for patients. You don't need to know the details. You don't need to know, again, you don't need to become a genomicist, but ask for that. I think, as I mentioned to you before, there are other tests that can be done. Of course, the one in your blood to define if you have susceptibility, like hereditary cancer genes, and if you're susceptible to have other cancers, or if your family members are susceptible to have breast cancer. Those are tests that can be done in your blood. In my case, I think you know that I wrote this blog, that I put this little article explaining my experience with this testing in Canada, in BC. And in my experience, the test done in my tumor, it was reimbursed, is part of the standard care. For my case, that was absolutely great because, again, guided my treatment. Right. For the test in the blood, that was not included in the standard of care, is not reimbursed, and is a bit more of a challenge because then I had to pay it myself, and I know that in some cases it's not integrated in your care. It's like some extra that what can you do with that? There's also some other tests that can be done to see if you will have adverse events from some of the chemotherapy medication. And on this, there is a very sad story, actually, that happened this week in Ontario. A medical doctor that was diagnosed with colon cancer prescribed one of the chemotherapy medications for which you need to have a genetic test. They did indeed the genetic test for him and tested for a handful of genes only. That's the standard in that province in Ontario. I think they're testing for 4 genes in Ontario. They're testing maybe for 6 genes in BC, a bit more. But all to say that they're not looking at your entire DNA. The entire genome has 3 billion letters. We're looking only a couple thousand letters when we do these panels with few genes. So for this medical doctor, they did that test. That person was from Indian origin, is from India, working in Canada for many years. Unfortunately, well, the test was negative, so they proceed with the treatment. And he, in fact, developed very severe adverse events from that drug and ended up dying. So is it, when I read that, it really shocked me, and I was, well, it was a terrible shock for me, because this is a totally preventable death. The challenge there is that because he is from Indian origin, and the panels and the tests done in these 6 genes that we have here are all done in white Caucasian populations. We don't have information about those variants in other populations, or very limited information. We have a challenge with genomics around diversity. We're not testing very diverse populations. So when they did the whole genome sequence for the 2 brothers of this gentleman, of this medical doctor, they figured they have a mutation. It's just a mutation that is not evident in these 4 genes that they tested in the panel that did for him. So that shows the need, I think, for not just look at some parts of the genome, but the entire genome. And the blog I wrote, or the article I wrote, also advocates for whole genome testing. In my case, I was lucky enough that with the panel, I could get the information to guide the chemotherapy. But the ideal situation would be to have the whole genome, where you can see the entire set of variants, as opposed to just only the ones that have been tested, and that most of them have been tested in Caucasian populations and not Latino like me, or other populations like Indian, as this gentleman in Ontario. I guess the challenge with that still is the cost, because whole genome could be around $6,000, as opposed to just a panel that could be around $1,000 or a few $100s, depending. So it's still a big difference. We say in the world of genomics, and I have been saying for many years now, that the cost is decreasing, and is decreasing dramatically. From being $3 billion for the first genome, $1 per letter. $3 billion for 3 billion letters is quite expensive. Yes. Now we always say we can do it for $1,000, and there are companies that say they could do it for $300, $200, $100. The reality is that when you think about the analysis you have to do, the bioinformatics, all the reporting, all that, even though you can read the genome for maybe $100 or $200, your analytical components and to get a final report is expensive. So ends up adding cost to a total of potentially $5,000, $6,000, which is still difficult to implement in a much larger way.
Right. And whether that's going to be covered or not, that's a whole different story. And if the patient has to pay, and if they can pay. And
in BC, we have a program at the BC Cancer Agency that actually I was supporting as part of my role as Chief Scientific Officer at Genome BC and with Genome Canada. The program is called POG, Personalized Oncogenomics, and they are doing whole genome sequencing for patients with certain tumors when they have very advanced stage 4 cancer. So when I was diagnosed, again, the first thing I did, I contact POG. Can you sequence my genome? Can we sequence my tumor? And they say, well, good news is that your tumor is early, so your stage is very early. I'm stage 2, not stage 4. So if you're stage 2, you're not eligible. So good news, you have an early cancer or early diagnosis. Bad news, you cannot have the whole genome sequence.
And I wonder, if you didn't know so much, would you have gone, this, or like, if education is so important for the public, and as well as, I mean, any healthcare professional, to know about these technologies and genomic tests, because sometimes if the conversations are not brought up, then if you are educated and aware of them, you can start asking.
It's super important. And I think both education for healthcare providers, for the doctors, for the oncologists. I've heard, you know, maybe not in recent years, but I will be publishing in a few weeks another article, and that's about a patient, a woman from Dominican Republic that was diagnosed here a few years ago. And even though she said that she had a sister and her mom and one aunt with breast cancer, they didn't send her the test for hereditary cancer. So I think there's still the need to educate doctors, in particular family doctors. Oncologists are maybe more aware now because oncology is basically a genomic disease. It's your genome that's messed up, that they have to know about genomics. So oncologists in general are more educated about genomics. Family doctors, depending, there are some family doctors that are aware and are keen on thinking about this, some others not. So there is a big need of education there. Other specialties also, there's a need for education. And for patients, well, when I was diagnosed, I joined a few of these Facebook forums, for good or for bad. Sometimes it's like too much information there, and that is not really
helpful.
Yeah, it's sometimes very depressing, but also enlightening in a way that I'm surprised. I actually share my article that I wrote about genomics and my experience doing genomic testing and with the tumor and the blood. And I asked the woman in that, in particular for Canadians. I am in a couple of forums in the US and a couple in here. And I was really surprised, positively surprised, to see that many of them were aware about the test. They know the scores, they know why they got it, they know the difference between the tumor and the blood. Some others were not aware, and that really for me was great. Like, oh, I will ask my oncologist. I say, bingo, I did what I had to do. You know, what I wanted to do with my article was to create that, open that conversation and create that awareness and make sure people ask their oncologist and ask about their opportunities. And I think we're privileged in Canada, even though there are, variabilities and it varies from province to province. Most of the provinces have some sort of access now to genomic testing in the tumor and in the blood. There are some, like in Ontario, for instance, I think a couple of weeks ago, they announced that they got a donation and they will be doing testing for the blood, for hereditary cancer, for all women with breast cancer.
Oh.
I think we should do here in BC the same, and every province should be doing the same. We should offer these as part of the standard care. But some other countries are not in the same situation. I'm very close with, because I'm Colombian and I was trained as a medical doctor in Colombia, I'm very close with people and I'm also following very closely how breast cancer is being treated in Colombia. Some of the tests are available. The cost is super high. And the challenge, I think, also sometimes is the approval process. Like for a patient that maybe could benefit from testing their tumor, which is, I would say, almost all the patients. But well, let's say if we have a very stringent criteria, this group of patients will be prescribed the test. It takes really long time to get the approval, or sometimes you have to appeal. And for cancer, really, time is of the essence. Time is everything. Time is your life. You're alive, you're not alive. You get the right treatment in the right time, or you are messing up with your life, with your health and your future. So for me, the test actually took, I think, 2 weeks to get the results. After my surgery, 2 or 3 weeks, I got my results, and I knew already I had to start chemotherapy.
And they use the biopsy from the surgery, right?
Yes.
I believe,
Yeah.
yes, yes.
You can use also your biopsy from the initial biopsy, but they can use also in my case they use tissues from my surgery to do the genomic testing. But I think that's one of the challenges in developing countries. Developing countries are now having access, and because the cost is lower, they have more access. People are more aware. Clinicians are aware. But the timing, the approval process, covering the cost, we still have I think that I always say the three biggest challenges we have now with genomics are the diversity. The populations are not represented in the genomic studies. The equity, like some people in some countries don't have access to these technologies. I feel privileged. It's not only that I'm in BC, I'm in Vancouver, where we have one of the best in class cancer centers with cutting edge technologies, where doctors are, at the cutting edge, exactly aware of everything that's coming. They're leading the way nationally and internationally in oncology. So that's really the best place to be. So yeah, access, equity is a challenge, and access to healthcare and access to the genomic tools, to the testing.
Or even clinical trials, like if your country is, or even if you can move to a country that is hosting that clinical trial. And I also wonder if the type of cancer you have is for access for genomic testing could be different with different types of cancer. I talked about my mom's story too, and I've shared her story. She had pancreatic cancer, and the approval, exactly like you're saying, was so difficult. Asking the oncologist, can we do the genomic testing? No. And then after that, unfortunately, it wasn't funded, so we paid out of pocket for the tumor testing. But it's so critical, that test. Everyone can benefit, whether something good comes out or bad, nothing comes out. At least as a caregiver, and as her daughter, I can say I tried everything as I could. I did it all, so that also helps. I've always had this question: does different type of cancer also give different types of access?
Yeah, and there are some tumors, for instance, lung cancer, where targeted therapies have been developed for many years. There are drugs that are specific for people with that particular mutation, and the drug is targeting tumors with that particular mutation. And yet, there's not always a systematic use of genomics and testing for patients. So you wonder, the drugs are there, the personalized path for treatment is there. How come we're not using it all the time? It's saving lives. How come this is not standard of care? Same with the hereditary cancer. Exactly. The hereditary cancer, if you could detect that early on, before it becomes really, advanced or is metastatic or whatever, you're also saving money to the healthcare system. You're saving lives. And if you want to talk about money, well, let's talk about money. We're saving money to the health. Exactly. Prevention is the gold standard. So I think there's still work that needs to be done in that front. As you say, it's important for patients to ask, but we shouldn't be the ones always, the ones with the pressure in our shoulders.
Exactly, because it's already so much pressure and like the emotional roller coaster that you're in. I mean,
it's stressful.
It's so stressful. I wonder if you, right now, we're at end of November, if you go back to April, what would you tell yourself?
My God, that's a difficult question. If I knew what the path will be, I will just, I would say a little bit like what I say without knowing, but hanging there, this is for your benefit. Just go through these. I will maybe, that's something a little bit I regret I didn't do in a more systematic way, because some points I was so exhausted and kind of, overwhelmed. I wish I had a more detailed journal of the different steps of the different, because you forget. Now I think we're humans, we don't want to think much about that. And you try to forget and try to not think much and not ask much. And one thing we discuss with my partner always is, well, she's a writer. So, of course, for her, writing is important and is critical. So she's like, oh, you should write a book about your story. And say, well, maybe I'm writing blogs for now and just
And doing talk shows.
and talk shows and things like these. I might end up writing the book at one point. I do have my notes and everything, but there's some things that you forget. So I will just be more disciplined. And I think it's also a way, because again, I say it's a lonely journey, even though I had, you know, my partner with me all the time, and she has been my unconditional support for everything, everything. She went with me to every single medical appointment. She went with me to every single chemotherapy. She went with me to radiotherapy. She's been with me in this journey. Actually, it's funny because when recently after my diagnosis, she was recognized, her work, she worked at UBC, and she was recognized. There's an organization here called Vancouver. So it's for the Latinos that live in Vancouver, lots of artists. And Vancouver just nominated her for an award in arts and culture. And in May, when I got my diagnosis and everything, and we were in the midst of all this, we were at the ceremony. And I was, we were happy. And we say, this night, we're not going to think about cancer. We're going to celebrate this award. We went together and she won. She was the, one that's won in her category. And when she did the, acknowledgement and in the speech to, thank the organizer and everything for the award and receive the award, she said at the end of the speech, she said, we're going to start now a journey together. And she was almost crying. I was there crying in my seat, like, oh, so emotional. But yeah, even though, she has been there from day one with me and has supported me, my mom too. My mom has come 2 times to help during chemotherapy, during radiotherapy. My brother was here. I had so much support from family, from friends. Still, inside is a lonely journey. And for that lonely journey, I think back to your question, I think writing might help you, because there are some things that are difficult to say and difficult to share. There's some of your feelings that are, even though I have been super open,
Yes.
some of these very intimate feelings, it might be easier to write. So that's the one thing I will do maybe different. If I was to start again this journey, I don't want to be there again. I'm so happy I'm here now.
And you're finished with chemotherapy and radio.
I finished with chemotherapy. I finished with radiotherapy. I'm managing now some side effects of both. I still kind of feel my fingers, lots of things. But I'm happy to be here, and I'm starting to think about the future. When is it that I'm going to get back to work? Because I have been in medical leave. I decided also, I think that was an important decision, to just take the time to concentrate on my treatment. And lucky enough, I had the support again of my partner that was working, my employer that gave me the medical leave. But yeah, I'm starting to think about potentially traveling at one point.
Oh,
so
that's
it's good.
great.
It's exciting
Yes,
times.
yes.
It's exciting times. Looking for my hair. People say that will grow different, so who knows?
I mean, you look beautiful. So that's very good. So, losing your hair, this was part of the journey, and loss of hair seems to be a symbol for cancer. And a lot of people, when they see someone that have lost their hair, they associate them with just cancer, and they forget about the life they had sometimes before and even in the future. And, what were your experiences and thoughts on, before and after?
Yeah, well, it's interesting that you asked this question, because yeah, I remember going through chemotherapy, and I already lost my hair and everything. We went for a weekend to one of the Gulf Islands, trying to, get to see something else and relax. That ended up being a terrible idea because I got so sick. I had to get back. I was in the emergency room for about 2 days, 3 days. But anyway, one thing that struck me, because that was my first time in a ferry, with my, all protected and everything, but no hair. And I had my little hat and everything. But I always, I felt, and I was telling Maria, my partner, I was telling her, people are looking at me. People look at me like I'm sick. Yeah, I'm sick, but I it feels weird, even though people try to be, but they look at you like a snapshot.
Right.
Like if you are cancer, like cancer is such a stigma in our society. There's so much stigma around cancer that when you look like a cancer patient, because some people, I have met breast cancer patients that didn't need chemotherapy. So they didn't lose their hair. So they can go through the therapy, through the radiotherapy and oral treatments with maybe not people knowing it, as opposed to me that you see in your face, she has cancer because her hair and because. So yeah, that's again, I think it goes with the stigma of cancer, and that was at the very beginning, when I decided to go to be very open about my journey. More than thinking about genomics, I wasn't thinking that much about genomics, honestly. It came later when I started to think, oh, I have a story. I have something to tell here. I'm a genomicist and I'm experiencing this genomic test. I should tell people about it. But before, it was more the stigma that people don't say, don't talk. And I started to get so many messages from people that I knew, from my network at work, that told me, oh, me too, I was diagnosed last year. Oh, me too, I was diagnosed 2 years ago. And I didn't even know about these people. Our society is still, a society of the healthy and the wealthy and the ones that are driving and the ones that are. So when you're sick, it's like, stay there. I think we still have work to do, and work also for me, myself, that I'm not just a cancer patient. I had a life before and I had a life after cancer. So for me, keep that in mind. Again, as my partner reminds me every day, this is not just the end of your life. This is not just it. This is one chapter. This is one part.
That changed your life.
Totally. That changed completely because I've said that many times. Like, oh, now you can go back to normal. You finish chemo, you finish radiotherapy, you go back to normal. What is normal? There is no go back to anything because there is a whole new world and a whole new life in my head. I think one of the biggest lessons I was I was watching yesterday a documentary from Desmond Tutu and the Dalai Lama. And one of the things they struck me from what they say that I think is my biggest lesson from this journey is compassion. Like, I think you start to look at people differently after this experience and approaching people differently. Also, your perception of happiness is different. It's like I get the sense of now the need to enjoy every moment. Like, I go for a walk and I'm like, I'm alive. I can go for this walk. Thank you, thank you, thank you. So
Living it day by day, feeling every moment.
feeling every minute, and that compassion for others and empathy, I think are hopefully my biggest lessons from this challenging but amazing journey.
Amazing journey. Yeah. It was so lovely to have you. Thank you so much for accepting this, invitation and educating us and telling us about your story. It was very insightful. Thank you.
Thanks to you for inviting me, and thanks for listening to my story.